A warm welcome, dear viewers, today on our health television. Today we're going to talk about when the body is in distress. We repeatedly have the feeling that especially in today's times, the body is increasingly out of balance and that many therapeutic approaches might be taking a very radical approach. But I'm very pleased to have Alexandra Kotthaus with us today, a specialist in psychiatry and psychotherapy and also a general practitioner who will take us on a journey to regulate the body, but with gentler methods, deeper ones, and also for personal insight to move more into regulation, into self-responsibility. And how that works is what we're talking about today. Look forward to it. Hello, dear Alexandra. Nice to have you with us again. Thank you. I'm always very impressed by your entire journey. You have really explored psychiatry, psychotherapy, general medicine, up to biological medicine. And now you are increasingly saying, hey, we take the body with us. But of course, we also consider things that we might look at through methods like hypnosis and so on.
Hypnose und. Auch noch mal betrachten können.
I found cell communication very exciting, that I actually talk to my sick cell, also with a healthy one. And also with the healthy one.
It likes to be noticed too.
It wants to be seen. And yes, really going into that with you today, what does it look like for you? When is the body in distress currently? And where do you see us coming into distress, which we may not have seen at all, where so radically work is being done now? Perhaps also out of ignorance and necessity among the therapists.
So our bodies are in distress. Many bodies are in distress because we no longer live in a way suitable for doctors. There's hardly anyone left who doesn't have something. When I went to school, we had one person in the class with allergies and hay fever. With my children, the ratio was almost reversed. And that means we already have young people at the very least wearing glasses.
Minimum Brillenträger, yeah?
We could make a bet. Next show, when I come, I'm rid of the glasses.
Are you working on your eyes right now?
I've only had a slight improvement in diopters. But I'm not yet at the point where I can say it's a done deal. But I've already had cool experiences with it. Next time. So glasses on young people shouldn't be a thing. That's where it starts. All these allergies, asthma, hay fever, things shouldn't be happening. Menstruation problems in young women shouldn't exist. Who is still completely healthy at 40? And now you have to start from the age of 40. Yes, you're getting older and then the belly grows. But 30 years ago, it wasn't as pronounced as it is now. So our bodies are in distress. And now we try, or especially now in this health life scene, many people are trying, even those who aren't so sick, that they already go to a doctor or by a doctor, but simply have a certain health awareness, are now self-experimenting and trying to get their metabolism fit again and doing more sport, whereas often too little sport was done. I believe Switzerland may call itself the only European country by far, which is at the top in terms of physical activity, sports, breathing, going to the mountains and so on. But it has really become quite a boom. Yes, I do fitness, I go to the gym and stuff like that. But it is...
Are you looking for videos on a specific topic?
Dann lassen Sie sich durch die Kai-Sana-Suche die inhaltlich relevantesten Sendungen zu Ihrer Suchanfrage generieren.
So now it's going in the opposite direction. The bodies are being put under so much strain, but they're not given what they need for that. And you also can't completely compensate for an office job just like that. And that's also the case with women. I also have older and even elderly women who are now lifting weights. I need to maintain my muscle mass, my bone must not deteriorate, and I think, okay. So that's already become quite a trend.
Yes, it's actually like in conventional medicine, you only look at one thing. You've brought a nice model with you showing how everything is connected.
Exactly. So for that, I've brought along the gyroscope. I have a gyroscope to illustrate to the patient how the body works. A gyroscope stays in its center. And then I used to sit on my doctor's chair and say, you know, your body does this, it gets a push, and then it tries to regulate again. I do that more elegantly now. Namely, the body gets a push and then tries to regulate again.
What is this push?
This push, it can be different things. You could also say life. I'm not so much a proponent of life is a pony farm and meant to be beautiful. Sure, life can be beautiful, but I rather think life is a roller coaster. And that's life. There are simply ups and downs. And we are indeed equipped for it, both on the physical level and on the mental level. We have safety nets. And there too, everything is interconnected. And to illustrate this, I brought the tensegrity model by Buckminster Fuller. So it is tension and integrity. Hence the name, it is interconnected. And there is a certain tension, there is a certain dynamic there. And that's why we also have buffer systems. And only when that fails do the symptoms appear. And I always take the example and say, look, when I change a hip, it's not a car tire. There's a system attached to it. It doesn't stand alone. There are fascia, muscles, nerves.
But no one can. Yes, exactly.
That's why I did the other show back then. Your body works like a woman and not like your car. More complicated. A little more complicated. Even than a woman. Now, many people are coming, or many people are noticing here, the pendulum around the middle, the perfect state, that's a homeostasis. That's not a rigidity. It's a homeostasis, a flow equilibrium. But they come here, and then someone comes along and says, you have to ice bathe, you have to fast, you have to do extreme, what's it called? Or do hyperbaric therapy. And in doing so, mildness already helps incredibly well. And then you can now imagine the body's regulated here. Then it gets a push. I would say that can go well. It doesn't have to go well. And of course, those for whom it goes well, they are enthusiastic and they pass it on. But I also sometimes squeeze the last bit out of the body. That works for a while, and you think, that's a good method. Then you relapse again, because you like to blame the inner pig dog, because at first the method helped well. And actually it's not the pig dog, but it's the body in distress, which wants to move away from the method again, having exhausted its compensation mechanisms. So even with this fasting, it might have been a good idea some time ago. Then I was at a conference, and then also, yes, this fasting and carbohydrates are so evil, and intermittent fasting is great. And then I do apoptosis with it, and then I activate cetogenes with it. And I'm thinking, like, I've talked to the cells. I don't even know if they find it funny being forced. And then in this lecture, it also says, yes, we want to stimulate the vagus, we want to reduce stress, the stress hormones, adrenaline, dopamine, cortisol, were really listed there. And then I'm thinking, do you actually know how intermittent fasting works? The body has one mechanism to lower blood sugar levels, insulin, but 3 to increase it. because we die much faster from low blood sugar than from slightly elevated levels. That's a survival mechanism. We force the body into the survival mechanism now to release more cortisol and adrenaline. So it's cortisol, adrenaline, dopamine, which is then released to keep the blood sugar level constant when it drops. And that also improves mood. If the systems are still working, it also does fat burning. It reduces inflammation a bit. But it can also lead to adrenal burnout. The liver is constantly busy producing glucose because low blood sugar is life-threatening. Who doesn't know this? Haven't eaten for too long, system might not be working quite optimally. Eat. And then you're on the go. I got to hear a story this morning, was on the go, and there was nothing else. And then I stood in front of McDonald's. I was told, then I had to eat that. I say yes. I know why they had to eat that. Because their body urgently needed energy. And then we blame it on the inner sloth and rarely blame it on the wrong diet that we consider healthy.
Yes.
So we have emergencies and we try to regulate it by worsening the emergency. That's something that's common. Anyone who is fundamentally very healthy, who in their low-carb diet has a huge portion, it exists, of greens and also meditates. With someone like that, it lasts much longer than with most others. But I also know enough patients who have tried all of this extensively and still have yo-yo effect. No, it's not despite having yo-yo effect, it's because of the yo-yo effect. These methods have no long-term proof. Long-term proof, first book, is now on the market. It simply states clearly that those who want to lose weight in the long term should neither eat a lot of protein nor low carb. This is coming now because the long-term proof was missing for these recommendations until now. It was not study-based, only the short-term effects.
And there the key is certainly that this method really leads to self-connection through cell communication. Maybe at first, of course, through a doctor who accompanies you to become more self-assured.
But that is what I do. I have overweight people. For most people, it works in the initially overweight to mid-range area only through dietary changes. Our diet, for many, it may initially seem a bit like, I'm not supposed to eat that anymore. And there already, of course, it's plant-based. Plants have many advantages. We are made to eat them primarily. We can eat certain other things, not necessarily. And regulate a lot, ultimately, by doing a kind of reset with this diet. And I'm not saying you can never eat certain things again, but it leads to better communication with your body, and it tells you more clearly, you will increasingly understand the language of the body. I want this, I don't want this. You can do this, you can't do this. And of course, this can be massively reinforced with hypnosis. When it comes to overweight, many people, even many who are not, are quick to judge overweight people or say the spare tire is an emotional wall. Or to say, yes, he is surely secretly, but usually there are hardly more disciplined people than overweight people. I can't keep up with that. What all they have already tried and gone through. But there too, cell communication helps. And then you can get to the point where you are allowed to use the expression. Then you can eat whatever you want, again. But you won't even want to eat those really bad things anymore.
I know since we've already had conversations, this generalization doesn't really exist. If you are overweight, you need protection, and here and there.
Yes, exactly.
But still, to learn a bit about you, what needs can an overweight cell really have? So what kind of answers do you often get?
I have, as I said in the other interview before, the most common answer I get from all cells, no matter the topic, is love. love and attention. And what the cell says can be completely different. It can sometimes be the grandmother who experienced the war sitting in the neck and went hungry.
And it also shows up in communication.
Such things have also happened, so it doesn't always have to be something one would think of. That's why I always warn against this type of pigeonholing. It can be that with the umbilical cord, circulation disorder during pregnancy. In the umbilical cord, I have now had some impressive cases where the mother had a traumatic experience during pregnancy, which can affect so much, but not just in relation to eating, also other disorders.
But may I ask you briefly, because we now have childbirth in the German-speaking area. When I think about the birth of my children with the not knowing that I had back then, with this much too early cutting of the umbilical cord, this giving birth while lying down, which is completely against us women anatomically when you research where that comes from, why we lie down. Actually, a standard birth is already a consciously set trauma where I say we should all somewhere at.
Ein bewusst gesetztes Trauma, wo ich sage, eigentlich müssten wir da alle irgendwo an den...
So the child does not immediately come to the horse.
No. Well, you can't say that.
Not everyone suffers equally from this principle. Or have we already gotten used to it?
No, well, it's really, if you assume that a soul is also not a blank slate when this body comes into the world.
Wenn dieser Körper auf die Welt kommt.
You can't really say that. So not every birth is necessarily a trauma. I also have many patients where the birth or the pregnancy doesn't come up. That's not the case either. Not everything can be traced back to pregnancy. You made an observation with certain criteria, with certain cell criteria. I know, that sounds like it was laid out very, very early.
So an, als ob das sehr, sehr früh angelegt wurde.
So that's how it is. I can already see they develop. I might need a few more data to collect, but some patterns are developing there.
Entwickeln sich manche Muster.
The methods you work with, these are trainings for psychotherapists and also for doctors.
Fortbildungen für Psychotherapeuten und auch für Ärzte, also das hat ja richtig...
They are, but not only.
Also ja, aber ja.
It's actually not rocket science.
Kein Hexenwerk.
Some further training is for psychotherapists. Hypnosis training is, theoretically, anyone can do it. But it's not like I have also gained my own experience. I do hypnosis and speak enthusiastically about it. And then even when I gave a seminar participants told me stories about hypnotists where I thought, okay, so you shouldn't do the training just anywhere.
Okay, also überall darf man die Ausbildung auch nicht machen, ne? So.
I've heard some rather strange stories where I have to say there's a bit of a lack of quality standards in some training, and that leads to the method itself being discredited.
Verunglimpflicht wird.
Although it's actually a good thing.
But we have that in every field. So you have that everywhere, whether it's painters or you have people everywhere who are good at it or not.
Du hast überall jemand, der hat's drauf oder der hat's nicht drauf.
It's just interesting that defamation works relatively well in that area in a general way.
Doch relativ gut funktionieren.
Where I say it's really about having doctors like you who say, this is part of it and it works.
Und das funktioniert.
Well, I don't want to say there aren't many roads that lead to Rome. Even for these methods, this approach. I now have multiple tools and also
und eben auch
tools for people who might not have German as their mother tongue.
Sprache haben.
I can also do it. At first I was a bit hesitant, but now I also hypnotize English speakers. But sometimes I must say, if it's not a native speaker, then it might be difficult for them. Because sometimes people really fall into their language during hypnosis.
In der Hypnose. Und
that can be managed, but it's also completely okay if someone does that.
Auch völlig okay, wenn das jemand macht.
And that there are also methods that are effective, where I don't need language at all. I also find that mega fascinating. I would not have thought it possible that it could reach such an intensity, even a trance that you do without words. Chirotrance. So chiro means hand, where hypnogenic zones on the body are touched and someone gets a trance. And it's not a coincidence that it works. Or it works sometimes and sometimes it doesn't. It really works. The phenomenon, I have done it within our team and it worked on me too.
Das hat ja auch bei mir funktioniert.
Wow. Cool, it works. It has never not worked to get into a trance with it. That's really impressive. I'm also pretty happy about that myself. I also really, for a long time, I actually started my career in psychiatry or psychosomatics, and I lacked these efficient tools.
Yes, and maybe to say again, even if someone comes to you and says, wow, I've already been through so much psychotherapy, nothing works for me. I don't know if you've heard that sentence before.
Yes, of course. I know that sentence.
What do you say to that?
We'll see about that. Yes, it's also completely obvious that it doesn't work, because talking about it doesn't help. But I also have patients who say, I've been hypnotized. Then some say, I've been hypnotized, but I don't know if it worked for me. I was awake. Then I thought, okay, then the hypnotist probably didn't explain well what hypnosis actually is. But someone who has basically already registered, oh, I was awake. I wasn't manipulated. Then I have relatively easy playing. But by now, I also know methods where people say this is hypnosis, where I would say this is not hypnosis. This is an attempt at guided meditation. And hypnosis has a proper hypnotic induction. And then you also have to check if the person is really, there are trance signs that can be observed. And you can also verify with other techniques whether someone is truly in a hypnotic state. So that also belongs to the toolkit to do that. I also have a patient who couldn't be regressed. He experienced terrible things, it just didn't work. Then I just switched tactics. I didn't provoke it with force. Then I thought, okay, let's do a hypnosis for beauty. First, you get to know the state of hypnosis, trust the process, and then I let it as deep as possible. And then he says, after waking up, he said, I don't see it, I get the images, I get the counter image. No, nothing. Okay, now let's go deep, beautiful, deep, beautiful, deep, beautiful. Then he stands up and says, you know, it couldn't go any deeper. I was somehow already in the cushion. And just before you brought me back, it felt like someone put a hand on my shoulder on the left. I was sitting on the right side. It was me. And then I knew he can do it. The ability is there. The willingness is there. But I must not book too strongly. And sure, I also have this compounding and go in again and again and repeat again and again and give a suggestion that might be agreed upon at the beginning before the hypnosis. But I do it a little differently as a psychotherapist too. So I also learned some useful things earlier. What I mainly lacked was this technique to get into the tones, because that is the actual state where change takes place. And then I simply reach into my repertoire, into my toolbox. I don't whisper a suggestion into the system that it might reject in some way. But I then have different methods to consolidate what has been resolved, to make it clear to the cells that the success remains. And I don't force it, not over again.
I think every topic also has its own timely justification, and you also need a certain resilience or perhaps circumstances that say, okay, now I'm ready for this information. And my environment too. There are also things, I know this myself, if I had recognized them 10 years earlier, I would have dealt with them very differently.
Wäre ich ganz anders damit umgegangen.
I would have pushed through very differently and certainly stirred up a completely different wind. And sometimes it takes a certain maturity or resilience or awareness to handle certain information, insights or experiences that come up.
If I could have done that earlier, I probably wouldn't have acquired so much biological knowledge.
Nicht so viel biologisches Wissen angeeignet, was ich jetzt
I can let it flow into hypnosis.
lassen kann. Ne? Das ist
So I already see the meaning in my path.
und
It will certainly continue, but I also see that with this mixture of methods, I can reach more and more people.
ich immer mehr Menschen abholen kann. Ne?
I'm also not saying, hey, I reach 100% of the people. I'm not the sugar-coated type, I know that too.
Und
But my inner aspiration is clear. I'll stop learning when I'm at 100% success.
zu lernen, wenn ich bei 100% Erfolg bin.
I know it's a utopian statement, but that's completely clear to me. By my nature, I will learn and progress until the end of my life. It doesn't feel bad at all. I think it's great. Yes, nice.
Schön.
It also suits you by nature.
At some point, I came to terms with it.
And the nice thing is we get it on all levels. Whoever, God or whatever, has given us all the mirrors.
Die ganzen Spiegel gegeben.
We can read it in the palm, we can read it in the face, we can read it in numerology, we can read it in human design. And this type that you are, we find it everywhere if we want to see it and come more and more to ourselves through these mirrors and helpers, and then also use that. Wonderful. Thank you very much, dear Alexandra, for accompanying us today on the journey to ourselves and truly being a great companion or helper to your patients.
Wegbegleiter oder Helfer auch bist, ja.
Thank you. Dear viewers, I hope you also enjoyed looking beyond the horizon in our cell communication to increasingly immerse yourself in finding the ideal, best way to ourselves. And I thank you, of course, for watching. See you soon. Goodbye.
Thanks for watching Swiss Health Television QS24. Please don't forget to subscribe to the channel down here or watch all our programs ad-free via Wikisanen or watch this selection of programs. I wish you all the best until another time and goodbye everyone.